Periodontal disease is a chronic inflammatory condition that affects the supporting structures of teeth, including the gums, periodontal ligament, and alveolar bone. The severity of periodontal disease can vary, and it is classified into different stages based on the extent of tissue damage and bone loss. In periodontal disease patients, there are significant microbiological changes that occur as the disease progresses. The oral microbiota in healthy individuals is diverse and stable, with a relatively low number of pathogenic bacteria. However, in patients with periodontal disease, there is a shift towards a more complex and pathogenic microbiota. In the early stages of periodontal disease, there is an increase in the number of gram-negative anaerobic bacteria, such as Porphyromonas gingivalis, Tannarella forsythia, and Treponema denticola. These bacteria are known to produce virulence factors that can destroy the periodontal tissues and cause inflammation. At this stage, the microbiota is not yet fully established, and the host immune response is usually able to control the infection. As the disease progresses, the microbiota becomes more complex and diverse, with a greater number of pathogenic species. In moderate periodontitis, there is an increase in the number of gram-negative bacteria, including Aggregatibacter actinomycetum comitans, Fusobacterium nucleatum, and Prevotella intermedia. These bacteria can penetrate deeper into the periodontal tissues and cause more extensive tissue destruction. The host immune response becomes overwhelmed, and the inflammation becomes chronic. In severe periodontitis, the microbiota is even more diverse and complex, with a higher proportion of gram-negative bacteria and a greater number of species associated with periodontal disease. In addition to the bacteria present in moderate periodontitis, there is also an increase in the number of anaerobic bacteria, such as Porphyromonas endodentalis, Prevotella melaninogenica, and Filofactor illosus. These bacteria can invade the bloodstream and cause systemic complications, such as cardiovascular disease and preterm birth. Overall, the microbiological changes in periodontal disease patients reflect the progression of the disease and the increasing severity of tissue destruction. Early detection and treatment of periodontal disease can prevent these microbiological changes and improve the overall health of the patient.